Good evening and welcome. You are watching Nonsense Talk News Live and I am Pallab Ghosh with you. A very serious news coming from West Bengal this time. It's the Nipah virus. 2 nurses in Barasat, West Bengal, contaminated Nipah virus and right now are undergoing treatment at a hospital. They are on mechanical ventilation system. Their condition is stated to be critical. Now, what's Nipah virus? Before that, let me just jog your memory a bit. We perhaps first heard of Nipah virus in 2021 and then in 2023 when cases were reported from Kerala in southern part of India, and this time it's West Bengal. As I said, 2 nurses have been detected with Nipah virus and are in a critical situation. However, Union Health Minister J.P. Nadda, who said that he had already spoken to the Principal Secretary and Home Secretary in West Bengal State Government, Mamata Banerjee's government, and have assured all the assistance regarding the treatment and other details on Nipah virus. J.P. Nadda said that guidelines have been issued to the West Bengal State Government under the State Integrated Disease Surveillance Program, IDSP, Public Health Emergency Operations Center, PHEOC, and National Center for Disease Control, NCDC, Delhi. Apart from that, J.P. Nadda also informed that Union Health Ministry is keeping a round-the-clock vigil on the situation and assured people in West Bengal that though the virus is serious, situation is grave, but they need not to panic, rather take precautions, because according to the WHO, this virus is predominantly spread by pigs and bats. It's called zoonotic virus. Nipah virus, as I said, was first heard in 2021 in India and then in 2023. Stray cases were coming up from Kerala. However, people in West Bengal have been advised to be very careful because, as you all know, when there is an outbreak of any kind of virus, a large part of the city, a large part of the district, villages are definitely under the scanner. And according to the statistics, few more people have been found affected with the virus, but they are not critical. So right now the situation is not that grave. But I was listening to some of the medical practitioners, some of the doctors on media, and they said that Nipah virus is deadlier than the COVID. In COVID, according to them, the fatality rate is 1.8 to 2%. But in Nipah virus, the fatality rate is much, much higher. It's 40 to 85%. In some cases, 90%. Which means double, triple, quadruple the risk is. So, the situation is grave, situation is serious, but all we have to do right now is take basic precautionary measures. And before coming to the precautionary measures, let me also tell you the symptoms. The symptoms are much like flu. The patient is detected with fever, nausea, headache, body ache, But the serious part of Nipah virus is gradually the patient feels there is some kind of numbness in the brain because it affects the brain. Your brain gets inactive because swelling takes part in the part of the brain. And naturally, the patient subsequently dies. Because as I said, Nipah virus is serious. Nipah virus, the mortality rate, the fatality rate is very high compared to COVID, which actually had sent scare wave, which actually created trauma. I think we all know what we had gone through between 2020 and 2023, and still now, whenever there are cases of COVID virus outbreak or some reporting of COVID virus being found, how people are scared because people have seen that. Now coming to the precautions. Precautions are very simple. Doctors have said to stay away from bats and pigs, contaminated food items. If you feel that a particular food is contaminated, if you find guava or lychee with bat bites, then don't consume that, because bats and pigs are the main source of Nipah virus. Apart from that, the medical fraternity has advised to maintain a regular hygiene routine. Wash your hands carefully. Wash your hands with soap. And you may use sanitizers, but I'm not very much in favor of sanitizers because we had done enough stories against sanitizers during the COVID. As we all know, sanitizers were not good for health. But anyway, it was a trend during COVID and we all used sanitizers, some part of the other. Now the main part is avoid contaminated food in the market also, because you never know. Especially I'm saying this in West Bengal, because cases have taken place in Barasat, and naturally when there is a virus outbreak or an epidemic, in case of pandemic as we saw, this too is highly contagious. So be careful. As I said, need not to worry at the moment. Need to take precautions. Be safe, stay safe, follow the medical advisories, and of course maintain basic hygiene. Your basic hygiene routines. Well, more on Nipah virus in the coming days. But right now, be safe, stay safe. This is Pallab Ghosh signing off for Nonsense Talk News.